Hi, I'm Paul Peterson. Welcome to the newly formatted Aging in LA. Today we're going to spend some time with the AIDS Project Los Angeles because, believe it or not, the issues surrounding AIDS fall especially hard on our seniors. So please stay tuned for Aging in LA. Welcome to Aging in LA. We're in the AIDS Project Los Angeles offices and I'm going to be speaking to several people. But first is Mr. Richard Levin, who is a mental health professional. And Richard, thank you so much for coming and joining us today.
My pleasure.
If you could describe briefly, what are the major issues for seniors living with HIV/AIDS?
You know, the thing I hear the most is that they feel invisible.
Really?
Yeah. They're oftentimes are alone,
Yes.
without companion. Either a companion has died or there perhaps wasn't a companion.
Mm-hmm.
They don't have a lot of skills in terms of building relationships, friendships. And so they're not open or comfortable going out into a community that's oftentimes 20, 30 years younger than they are.
Yes, of course.
And the reality is they are oftentimes invisible. You know, as are most older people.
Yes, older citizens, exactly.
You're not, yeah.
Now, what about family issues? So often there are estrangements and tensions within a family when a son or daughter is openly gay, or maybe in the closet gay.
Yeah.
Are you able to enlist the support of family members once you have a chance to counsel the people living with AIDS?
One of the things that with the older adults is that, especially if they haven't disclosed to family, is that the families are elderly.
Yes.
And oftentimes ill or are not capable of taking this kind of information on, or the client feels that they don't want to burden the family. So families are oftentimes, especially if they haven't been told earlier on in the process of that the client is gay or the client is HIV positive, they're loath to enter into that conversation.
And yet so often the members of our gay community are the primary caregivers. They are, in many instances, are in fact the closest to their mother or their father and have been giving the care that seniors need.
Well, this compounds the stress because they're often responsible or often the caregiver, and yet their own health issues or their own emotional issues go untreated or unacknowledged, or there's just no place for them to talk about it.
Are you able to give counsel on respite care where, you know, the caregiver is given a break, if you will, just to have their life back?
Yeah, we have I run a group for men who are HIV positive and over 50, and they're probably the best advice givers and counselors of each other.
Yes, indeed.
They provide a sense of humor, a context. They understand what it was like 20 years ago. And these older folks, including myself, listen to others who are of the same age.
Right.
And especially if they're going through the same kinds of issues.
Well, so many of our senior gay population have many issues of loss themselves. They have lost their partners and their significant others over time.
One of the things that I've also noticed, I see in the group, is that some of these folks who are anywhere from 50 to 86 have lost a group of friends maybe 20, 25 years ago and have managed to accommodate that. But then as they grow older and their own losses are compounded, their own physical losses, the losses of their parents, the losses of their friends, becomes overwhelming. It's almost as if the cup is just so full it runs over and they're at a loss.
But that's where you come in.
That's where I come in, and that's where their colleagues come in, their peers.
Do the support groups, you mentioned a group before, the support group, at least in my experience, is always worthwhile because you have people with similar interests and backgrounds, and they can go, oh boy, I remember those days.
Yeah, I've run a number of support groups in my tenure at AIDS Project Los Angeles, and this is the most entertaining and the most touching.
Yes.
They are the humor and the sense of irony mixed with their life experience is just, and their knowledge.
Yes.
This is the other piece that I've come to understand, is that the accumulated knowledge and experience of these folks is not highly regarded in our culture, and in the gay community specifically. And so it's an opportunity for them to be able to articulate, to teach, and to get a sense and to hear themselves expand on their experience and the knowledge and the information that they do have.
Yeah.
And it's a wonderful process to observe and to participate in.
Well, it's so important, the work you're doing, and I'm speaking as a parent of a gay son whom I love like crazy, and piece of advice, if you'll allow me. If your child is gay, you love them and pay attention, because you can lose them in a minute. Thank you so much, Richard. This has been a pleasure talking with you. And now it's time for Dr. Gil Kajiki.
Let's talk about vertigo today. Now, vertigo can be anything from room spinning to rocking side to side like a ship or dipping back and forth. Now, do you know what the #1 cause of senior citizen deaths are? You might think it's heart attacks, you might think it's strokes, it's actually falls. And why do you suppose people are falling? Because they lose their balance. They lose their balance because they can't feel their feet or the room is moving around. And so we're going to talk about some of these causes of vertigo, but vertigo is so diverse, any number of these mechanisms could be the reason why you're having vertigo. Now, your vertigo can come from internally in your brain, or it can come from the outside, which is your ears. Now, most commonly, it does come from your ears. It's called BPPV, benign positional paroxysmal vertigo. That's the most common one that there is, and it's usually the easiest one to take care of. But when that one can't be taken care of through traditional medicine, then we're talking about what we call a central vertigo problem, meaning it's inside your brain. And here's the most likely place that your vertigo will occur. On the back side of your brain here is called your cerebellum. You have a right cerebellum and you have a left cerebellum. Now, the cerebellum is so important that it's responsible for your balance, coordination, how clearly you think, and all the spinal muscles from your neck down to your lower back. So many times we'll find that people have accompanying neck problems with this vertigo, then we know it's probably a cerebellum problem. And this cerebellum needs to be recalibrated every so often, otherwise it doesn't know what different parts of the brain are functioning. And very often we find that this is where this vertigo comes from. When it can't be taken care of through medication and it can't be taken care of through traditional methods, we find that the cerebellum is the key to this vertigo. And we've got different therapies called brain-based therapy in order to help this cerebellum. Now, once again, we talked about blood sugar in the past. Blood sugar is one of the reasons why the cerebellum goes bad. Okay? The brain hates blood sugar fluctuations. So by controlling your blood sugar, that one thing alone can help with your vertigo. Okay? The other thing is you got to watch the bottoms of your feet. If you can't feel the bottoms of your feet, you're not going to be able to know where you're walking, and the likelihood is you're going to have a fall. So this vertigo can come from a number of different ways, but get your blood sugar checked out, get your feet checked out, make sure you can feel your feet.